This month, Vivent Health Services will hold its Make a Promise Gala, acknowledging 40 years of service to fighting the HIV/AIDS epidemic in Wisconsin. In the early days of the epidemic, most of the people who contracted the disease died. By the turn of the century, almost 500,000 people in the United States had succumbed to the disease. Thanks to medical advantages, HIV does not have to be a death sentence today, but there are still challenges. Originally thought to affect white gay males, it quickly became apparent that the disease did not discriminate. Anyone was susceptible.
But communities of color are bearing the disproportionate burden of new diagnoses. And while HIV can be a managed, a long-term condition, for folks without resources or folks with limited access to care, it can still be a death sentence. We know that tons of structural issues, including racism, redlining, the way that neighborhoods and cities are laid out, public transportation access, disenfranchise and marginalize Black and brown communities. And along those lines, we see health disparity.
And when I found out, it was horrible. Only person in my whole family, not my immediate family, my entire family, meaning my mom's siblings, okay? Didn't have anyone to talk to. No one to talk about anything. And the only thing I can remember is the little time I've seen little clips. People would know, and in 6 months they were gone.
Terry is not gay. An award-winning 290-pound kickboxer at the time he contracted the disease. He had a fiancée, then a girlfriend, and a child. None of them have tested positive for the virus.
So first I went and tried to see a doctor, and he said, well, she started shaving the hair off my chest. So I looked and said, wait, what are you trying to do here? And she said, I'm going to put the cat rest. Anxiety, I can't do that. So what do you do? Is what I'm thinking to myself. And I decided to do nothing.
Eventually, he did do something as the disease began to affect him physically.
So after a while, you start the wasting, you get the little sores in your face. And I met a doctor. Dr. John Fleming says, okay, well, let me tell you, you might be strong enough, but you look like me, okay? And I say it. And the nurse said, oh my God, you just said it to him? He said, it's somewhere I can get to him. Must give the same shot back that I gave him, I took the medicine all the time. And I started trying different things, different medicines. And then he says, and this we talking now, this is year 2000. You start seeing a counselor, a dentist, a therapist. Then you start feeling like you're not an outcast, so to speak. You start feeling like there's somebody that's not going to judge you, somebody that's going to help you. And that's the best feeling you could ever have.
As a longtime survivor of HIV, Terry has a perspective that many of Vivent's new patients don't.
There are young people today that may have never known anything about the HIV crisis or AIDS crisis that was experienced, won't know about the quilts, the marches, the climbing buildings, the advocacy that it took to get where we are today. And in turn, we do see that young people are engaging in behaviors that may put them at risk for STIs and HIV. And now current data is even suggesting that particularly young people of color, are more likely to be exposed and could become infected with HIV.
I had sex, and I was like 21, 22, and it was a guy I was dating, and it was rumored that he had it, but like, people, gays talk, so I didn't like think nothing by it, but I was very educated about it, so it was like the least of my worries, 'cause my mom had just passed, and I was going to a local organization to get tested for a gift card. I already needed the money, and my friend ended up testing me, who works there, or worked there, and he told me I was positive, but I didn't I know so much about it that I wasn't phased, because it's not a death sentence anymore. And but it still has that stigma around it. Now there's so many resources, but sometimes in our society, people don't have, or they don't know the access to those resources, so they just kind of not getting that information. Any other disease, like diabetes, high blood pressure, I got high blood pressure, too. It's like anything else, like cancer. We don't discriminate against cancer. So, all right, HIV.
We've seen so much advancement in 40 years. If you really take it in different kind of decades, we saw the time where HIV/AIDS was a death sentence. And then that second decade, you start to see people living. The next 30, and the third decade, you start to see people thriving. 1 pill a day. Advances in prevention strategies. And really then in our last decade, you see viral suppression, meaning that you can't transmit the infection. People starting to feel more autonomy. People turning 75, having lived with HIV. Next year, we have a patient here who will turn 90, having been living with HIV for 35 years. You see people right. And while for some 40 years seems like a short amount of time, it's been a long period of time. It's been a moment where time was measured in months, days, and seconds. And now it's measured in years, decades, 25 years.